Hello everyone, and thanks for listening today. This is the RX Daily Dose. Today's episode is being recorded for Monday, March 30th, and I'm your host, Ian Parnagoni. We update this podcast every week for healthcare providers, medical professionals, and anyone who has an interest in drug updates. Don't forget to like, share, and subscribe on all your favorite podcast platforms and social media, including iTunes, Spotify, YouTube, and Instagram. All links can be found in the show notes below. This week, we only have one update from the FDA when it comes to new drugs. That's the approval of Zeposia for multiple sclerosis. The FDA also issued a statement regarding news reports on ibuprofen and the coronavirus, and we'll be going over our usual update on the coronavirus epidemic and flu season to date. The FDA this week approved ozanimod, which goes by brand name Zeposia, for adults with relapsing forms of multiple sclerosis, although the company says it will delay launch of the drug because of the ongoing COVID-19 pandemic. Zeposia is an oral, once-a-day immunomodulator that selectively targets sphingosine 1-phosphate, that's S1P, and 5 receptors. It's the first S1P receptor modulator approved by the FDA. The FDA approves Zeposia for relapsing forms of multiple sclerosis based on data from the Phase 3 Sunbeam and Radiance trials showing the drug reduces disease progression. Compared with Avonex, Zeposia demonstrated a relative reduction in annualized relapse rates of 48% through the 1-year Sunbeam trial and 38% at 2 years in Radiance. At 1 year, treatment with Zeposia reduced the number of T1-weighted gadolinium-enhanced GDE brain lesions more than Avonex. That's a relative reduction of 63%, and reduced the number of new or enlarging T2 lesions, a relative reduction of 48%. Similar findings were seen at 2 years with greater reductions in the number of T1-weighted gadolinium-enhanced brain lesions with Zeposia, a relative reduction of 53%, and in new or enlarging T2 lesions, a relative reduction of 42%. There were no significant differences in 3 and 6 month confirmed disability progression between treatment groups over 2 years. The most common adverse reactions were upper respiratory infection, hepatic transaminase elevation, orthostatic hypotension, urinary tract infection, back pain, and hypertension. Genetic testing before initiation is not required with Zeposia, nor is label-based first-dose observation, because of the possibility of a transient decrease in heart rate and atrioventricular conduction delays. An up-titration scheme is recommended to reach the maintenance dose. Zeposia is contraindicated in patients with recent myocardial infarction, unstable angina, stroke, transient ischemic attack, decompensated heart failure requiring hospitalization, or class 3-4 heart failure. Patients who have a presence of Mobitz type 2, second or third degree atrioventricular block, sick sinus syndrome, or sinoatrial heart block, unless the patient has a functioning pacemaker, patients with severe untreated sleep apnea, and patients taking a monoamine oxidase inhibitor. Before initiation of Zeposia, all patients require a complete blood count, including lymphocyte count, electrocardiogram to determine whether pre-existing conduction abnormalities are present, a recent liver function test, and consideration of current or prior medications. An ophthalmic assessment is required for patients with a history of uveitis or macular edema. The FDA also issued a statement regarding news reports that have come out in the past week or two regarding the use of ibuprofen and how it could potentially worsen coronavirus disease. These news reports followed a March 11th letter in the Lancet Medical Journal, which hypothesized that an enzyme is increased by NSAIDs and could aggravate COVID-19 symptoms. At this time, the FDA states it is not aware of scientific evidence connecting the use of NSAIDs like ibuprofen with worsening COVID-19 symptoms. The agency is investigating this issue further and will communicate publicly when more information is available. However, all prescription NSAID labels do include a warning that the activity of NSAIDs in reducing inflammation and possibly fever may diminish the utility of diagnostic signs in detecting infections. Basically, if a fever or muscle pain are symptoms of a disorder, and you take a medication that treats these symptoms, it may lessen the provider's ability to actually detect if you have that disease or not. For those who wish to use treatment options other than NSAIDs, there are multiple over-the-counter and prescription medications approved for pain relief and fever reduction. FDA suggests speaking to your healthcare professional if you are concerned about taking NSAIDs and rely on these medications to treat chronic conditions. And an update for you on influenza and coronavirus. For influenza this year, the CDC now estimates that in the US so far this season, there have been at least 39 million flu illnesses, 400,000 hospitalizations, and 24,000 flu deaths. 155 deaths have been reported in children. I put a link to the CDC Weekly Influenza Tracker where you can get more detailed updates on the virus. And for the coronavirus, and these numbers are as of Sunday, March 29th, the coronavirus death toll rose to 33,883. That doubled since last week, and the number of confirmed infections rose to 717,976. Again, double from last week. The United States is now considered the epicenter of the virus with 139,217 confirmed cases. If you remember last week, there were 32,356 cases, and the week before there were 3,083 cases. The jump is most likely due to the increased testing, and we'll continue to assume this will continue to rise as time goes on. We'll keep you updated every week as things continue to evolve with the spread of the coronavirus. And that's all I have for this week. I hope you enjoyed today's episode. I'll include all links in the show notes below, so please go back and check those out too. Please connect with me on any of your social media platforms and give me feedback on what you heard today. I'd love to know what you thought about the episode. And as always, feel free to like, share, and subscribe wherever you listen to your podcasts. And thank you so much for tuning in. I hope you enjoy the rest of your day. Music by Joseph McDade.